Hello, my name is Eduardo Mankowski. I am a radiologist doctor and I will be discussing the risk stratification system in thyroid nodules, specifically the thyroid system. And here is my presentation at the Israeli Congress of Radiology. There is no conflict of interest in this presentation. Our key points are prevalence of thyroid nodules, a brief history of thyroid's risk stratification systems, the thyroids including the 5 categories, scores, and recommendations, suggestions to improve our thyroid ultrasound practice. Thyroid nodules are very common. The vast majority of them are benign, although there was an important increase in FNAs between 1995 and 2005. Mortality rates have remained stable. This disparity highlights a significant concern regarding overdiagnosis. So besides unnecessary patient stress and anxiety, it leads to an overwhelming of the health system. In the context of overdiagnosis, the risk stratification systems must be specific. The ideal risk stratification system should have high sensitivity and high specificity, but unfortunately it does not exist. So it must balance specificity and sensitivity and also balance individual risks and overwhelming the system. If we can't have both specificity and sensitivity, we need to choose accordingly to the risk of each kind of lesion. Considering the nature of thyroid lesions, thyroid system can be more specific, reducing unnecessary biopsies and focusing efforts on nodules highly suspicious for malignancy. There are several ways to stratify the risk of thyroid lesion, including guideline, consensus, Doppler ultrasound, and also elastography studies. Most of the suggested systems are based on nodule patterns. This includes the Korean Tirads from 2021, which is the most recent among the relevant studies. Several Tirads classifications have been proposed along the years. Each one is adapted to the epidemiological reality of each country. We will focus on the ACR Tirads of 2017. It is easy to apply, involving a multiparametric assessment divided into 5 categories and have the great advantage of being more specific. The ACR Tirads provided a comprehensive quantitative system. A nodule is assessed across 5 sonographic categories, with points assigned to specific features within each category. So here's the ACR chart featuring a highly logical flow that facilitates its practical application. It works like this. We assign points in each of the categories according to the nodule's characteristics. We add up the points to get the thyroid's classification and then recommend the management, follow-up or FNA, based on the maximum dimension of the nodule. Let's move on and talk about the 5 categories. Composition is very important, and it should be the first thing to think about. It's divided in cystic, spongiform, and both gets 0 points. Mixed cystic and solid gets 1 point, and solid or almost completely solid, that gets 2 points. It's important to say that when we can't tell the composition, such as in a nodule with peripheral calcification, it also gets 2 points. Let's see some examples. Here we have a very common finding, a colloid cyst on the upper image on the right side of the screen that lacks clinical relevance. In the lower picture, we have an example of an almost completely cystic lesion, and both of them get 0 points. A spongiform nodule is also a very common finding with multiple cystic spaces that are variable in size and eventually in shape, but must occupy at least 50% of nodule volume. and it also gets 0 points with no further points from the other categories. Mixed cystic and solid nodules are a self-explanatory category and gets 1 point. Solid or almost completely solid nodules score 2 points. To be considered as an almost completely solid nodule, the solid component must be equal or greater than 95%. Now it's time to talk about echogenicity. This category is divided in anechoic nodules that get 0 points, hyperechoic or isoechoic nodules that get 1 point, and hypoechoic nodules gets 2 points, and very hypoechoic nodules that get 3 points. This is one example of a large anechoic nodule, and it gets no point. Those are examples of isoechoic and hyperechoic nodules, and both of them gets 1 point for this category. This is a hypoechoic nodule, and it gets 2 points for this category. And the last example is a very hypoechoic nodule. Very hypoechoic nodules are less echogenic than the strap muscles. So shape is what we can call a game changer category. It gives 0 points or 3 points. If the nodule is wider than tall, it gets no point, and if it's taller than wide, it gets 3 points. It's easy, but it must be on the transverse view. It's very important. Here are a few examples of a wider than tall shape that get no points for this category. It's also important to tell you that a round nodule also gets 0 points, as well as a wider than tall. A taller than wide shape of the nodule means that the nodule is growing against normal tissue plans, and that's the reason he is more suspicious. So he receives 3 points. So don't forget, a basketball player is taller than wide, gets 3 points, and he's a game changer. Margin is divided in smooth, ill-defined, lobulated or irregular, and extrathyroidal extension. Both smooth and ill-defined gets 0 points. Lobulated or irregular scores 2 points, and extrathyroidal extension gets 3 points. Smooth margins are very well demarcated, looks circumscribed, and very easy to identify. An ill-defined nodule, we can barely see its limits, especially if they are isoechoic. Both get 0 points for this category. Both lobulated and irregular margins receives 2 points. And extrathyroidal extension means not only bulging of the thyroid margins, but the lack of thyroid tissue in the bulging. That scored 3 points. Echogenic foci is the last category, and here it's important to note that is an AND category. All the others we've discussed were OR categories, and we choose only one possibility. In echogenic foci, we choose all that apply. Non or large comet tails artifacts get no point. Macrocalcification scores 1 point. Peripheral calcifications score 2, and punctuate echogenic foci score 3 points. So here an example of larger comet tail artifacts seen often in colloid cysts. They must be greater than 1 mm and scores no points. Macrocalcifications are calcifications that are shadowing and they get 1 point. Punctuate echogenic foci gets 3 points. They have no shadowing. Sometimes they may have small comet tail artifacts. It means less than 1 mm. Peripheral calcifications can be limited and partial, or they can be extensive and thick, sometimes in an eggshell appearance, and they receive 2 points. That's important to say that sometimes a peripheral calcification may obscure the inner part of the nodule, so the orientation is to assign 2 points if composition can't be determined, and 1 point if echogenicity can't be determined. Now just add up the points from each category to find out the tirads, and recommended follow-up or FNA accordingly to the side of the nodule. So let's review some important concepts. In composition category, spongiform must have at least 50% of small cystic spaces. Also, in composition, an almost completely solid must have at least 95% of solid component. A solid and iso or hypoechoic nodule is at least Tirads 3. A solid and hypoechoic nodule is at least Tirads 4. Shape must be evaluated on the transverse image. Very hypoechoic means less echogenic than the strap muscles. Echogenic foci is an AND category, therefore we must sum all that apply. The pictures should be in sequence. Overview, the thyroid and each lobe size and diffuse texture and vascularity. Each nodule must be registered on longitudinal and transverse views in sequence. Films may always help. Measure with the correct technique, looking for the biggest axis. It's important for follow-up. If there is a halo, it's part of the nodule and must be part of the measure. Keep a chart in the reporting room and a copy with the sonographer's team. Multinodular thyroid, the 4 most suspicious must be evaluated and reported, and it's strongly recommended to use structured reports with the lexicon allowing coherence in description, score, and clinical recommendation. The future is now. Contrast enhancing ultrasonography, elastography, AI, and radiomics are already being researched, and very soon we'll be ready to take part in risk stratification systems in large scales. To finalize, let's test our knowledge. What is the Tirads here? It's a solid lesion, 2 points. It's a hypoechoic nodule, more 2 points. Smooth margins, not taller than wide, and no echogenic foci, so no points from the other categories. Totalize 4 points. It's a classic Tirads 4. It's smaller than 1.5 centimeter. FNA was not required. In this case, it's a solid nodule, so it got 2 points. It's isoechoic, 1 more point. You can see in the transverse cut that it's taller than wide, 3 more points, so it gets 6 points. And it's a Tirads 4. Considering that the nodule is larger than 1.5 centimeter, FNA was performed, which resulted in a diagnosis of adenoma. In this case, it's a solid nodule, 2 points, hypoechoic, another 2 points. It's wider than tall, no points for this category. With peripheric rim calcification, another 2 points, so it gets 6 points, and it's a Tirads 4. This one is also larger than 1.5 centimeter. FNA performed, which resulted in a diagnosis of thyroid papillary carcinoma. Thank you very much for your attention.